Yes, people, good evening. It's Delvin Sadler. I'm here tonight. Unscripted, anything goes. For real. Yeah, man. Thanks for joining. I really appreciate it. Yeah, man. Unscripted, anything goes. I love you guys. I love you. I love you. I love you. I love you. On another Wednesday evening, it's a privilege and an honor to come here to actually do the show. I love doing it. I really do love doing this show. It's a nice show. Unscripted, anything goes. Straight up. Yeah, man. And I appreciate the fact that each and every day you join me at 7 o'clock to do this show. I really appreciate it. And I want to say thank you. Yeah, man. Big up yourself, Sharon. I love you, girl. Yeah, man. I love you. Straight up. Earl. Big up yourself, Earl. Yeah, man, thanks for joining, my brother. I love you. Yeah, man, straight up. Big up yourself. You see it? Chrome International, DJ Chrome. Big up yourself. Thanks for joining, my brother. Unscripted, anything goes. Straight up. Yeah, man, DJ Chrome, I saw your video, I saw your videos. Yeah, man, I saw your videos. Yeah, man, straight up. Yeah, man, thanks for joining. Unscripted, anything goes. Really and truly, people, tonight, very interesting topic that we have for you tonight. We're going to talk about breast cancer. Yeah, man, we're going to talk about breast cancer. So if you know any ladies out there, any ladies out there, you tell them to come here tonight. Come here tonight because we actually want them to actually hear about breast cancer. Yeah, man. Everything to know about breast cancer. Hopefully, I can share it with you tonight. And we're going to be talking about cancers for quite a while. Big up yourself, Princess Block. Princess Block. Princess Block. Andrea. Yeah, man. How you doing, Andrea? I love you, girl. I love you. Big up the Princess Andrea. Yeah, man. Big up the Queen Jacinta. Thanks for joining Unscripted, anything goes. For real. Gilman Sterling. Yeah, I'm my brother that. Yeah. Gilman Sterling. That's my brother. Unscripted, anything goes. And I want to thank you for joining tonight. Yeah, man. Straight up. Yeah, man. I love you, girl, Andrea. Yeah, man. You don't know. My heart belongs to you. Yeah, man. Straight up. Yeah, man, Beverly Bellamy. Beverly Bellamy. Yes, I love you, girl. I love you. Yeah, man, I love you. You don't love this topic. I don't. Yeah, you don't talk cancer. I hate that sickness. Yeah. Big up yourself, my brother Rascal. And I'm going to tell you why you need to listen to this topic tonight, Princess Black. I am going to tell you why you need to listen to the cancer, to the topic. The reason being because knowledge is important when it comes to information like this. Because cancer situations are life and death. And sometimes people live with these situations. They don't go to the doctor to get a regular checkup and screening. Yeah, man, big up yourself. They don't go to the doctor to get regular checkup and screening. So this is why it's important that Delvin now will shed some light on the situation to let you know that what are the signs to look for, and also the importance of going to the doctor to get yourself checked out, get a full physical, so that you know what's wrong with you. And if something is wrong with you, the earlier that you detect it, it's the better your chances are to actually get rid of the problem or to treat the problem so you can actually live a longer life. Because the longer you wait to deal with this situation, it could be the more severe the situation could be, which could lead to death. Yeah, I know we all have to die one day, but the thing about it is this: if we can extend our life to live and have a longevity in life, why wouldn't we want to do that? Why would we want to commit unintentional suicide? Why would we want to commit unintentional suicide? But if we actually know that something is wrong, or a possibility that something is wrong, we can actually extend our lives straight up instead of cutting our lives short. Big up yourself. Yeah, man. J-Tech. Yeah, big up yourself. Yeah, man. Thanks for joining. Unscripted, anything goes. Yeah, man. 8 cancer too. Yeah, 8 cancer. My best friend Cindy, I remember that. She died from cancer 2 years ago. And the thing about with Cindy's situation, close the door, my brother. Close the door, please. Yeah, the thing about with Cindy's situation, I doubt that she got screened early. I doubt that she checked herself out early. Yeah, because if she would have done that, yeah, I think she would still be here. So I know a lot of people die too soon, and they die too soon because they don't take the initiative to make sure that their health and well-being are in check. You could look good, feel good, but yet still you're dying. So it's incumbent upon you to actually go out and do a full physical of yourself to make sure that you're healthy, or actually put your path to become healthy if you're sick. Yeah, early screening and detection is the right thing to do. Yeah, to make sure that you're cancer free or to be treated early so that you can live a long life. Yeah, man, thanks for joining, my brother Sydney. Thanks for joining Unscripted, Anything Goes. And tonight we're talking about breast cancer. Tomorrow we're going to talk about cervical cancer. Day after, ovarian cancer. And then we're going to touch them for prostate cancer. We're going to touch them for testicular cancer. And we're also going to touch, yeah, the colon cancer. So we're going to be on cancer for a little bit. Yeah, man. Because to me, it's important to get our community information. Good, solid information. Information to which you can say, well, you know what? This is more serious than what I thought it is. And I need to take control of my life to make sure that I get myself, look out for signs, or actually go to the doctor and get properly screened. Unscripted, anything goes. And if you want to come on and you want to have a dialogue particular to this topic, you can feel free to do that. You have the right to come on the camera and do that. If you want to come on and change the subject matter and talk about something else, then you can feel free to do that as well. Also, you can type freely and openly. No one will block you. Yeah, man, straight up, this is Unscripted. Anything goes. And I love you people. Yeah, man, Denny, Chanel, thanks for joining. Yeah, man, Unscripted. Yeah, man, I love you, girl. I love you. See, Dana there. Dana, I love you, girl. Welcome to Unscripted. Anything goes. Cancer tonight. We're talking about breast cancer. So let's get straight into the show. All right, let me hear what Dana have to say. Hear what Dana have to say. Yeah. Big up yourself, Dana. Let's get straight into the show. Yeah, man, people. Yeah. Yeah, the phone is ringing. I don't know why, but you have to answer the phone. The show is going on. Yeah. Yeah, man. Yeah, man. Anyways, people. Yeah, Donna, you wanted to come on? You okay? Let me see. And then we're gonna go. If she doesn't want to come on, and we'll go straight into the subject matter. Yeah, man, Donna. Big up yourself, girl. Yeah, man. How you doing, girl? Yeah, man. I like the hairstyle. I love the hairstyle, man. Man. Yeah, man, man.
The locks I get back long again.
Okay.
So I put on the stocking head pan it, you know?
Yeah, man. You don't like when it
Me natural, you know.
Yeah, man, you're natural, man. Can't say that. You don't like when
Proper.
you don't like when the ear go in your ears or your eye and them thing, you don't.
Can't bother with it.
You can't bother with it. Yeah, it's the same thing with my wife. She has long locks. She always tie it up. Her locks long all the way down.
No, mind it down. Mind it down on the bottom, but me cut it. I went through a purification program which demand that I give up something that I love very much. I gave up the locks, but me regrowing it back.
Yeah, man. All
Mm,
right. So it's Beverly Bellamy saying that this topic is close to my heart, having had friends and family touched by the illness of breast cancer. Do you know anything about breast cancer?
mm, mm. Well, my auntie died from it. My grandmother died from it. My sister died from it. My
Mm-hmm.
cousins, actually, everybody in my family that was young. Well, my cousin died from it very young age as well. But one thing I have realized that with cancer, we have to take our lifestyle in order.
Mm-hmm.
The genes, we must check our bodies for carrying the cancer genes. Is very important.
Yeah.
And we women, we must practice to wear good fitting bras.
Okay.
And when
Okay.
it's time for us to do our mammogram test, we mustn't fail to do so.
Right.
Another thing is, if we see like we must notice our breast, and if we
Mm-hmm.
see like little pimples growing around the nipples, we
Right.
mustn't take it lightly. Because one
Right.
thing, I had a I had a scare a few years ago,
Mm-hmm.
and I started to take good, conscious care of my body.
Yes.
And I was shocked to realize that cancer does not start in the breast. The first place for cancer to start is in the womb, and
Oh,
then it
okay.
spreads.
Mm-hmm. You freeze up, my girl. You freeze up. You're freezing up. You're
Spreads.
freezing up. Yeah. Move your
Am I
face
freezing
away.
up?
Move away from the camera a bit. Yes, and then you talk. Yeah, it's gonna freeze. Go ahead.
Right. So I realized that once we start to take care of our bodies, rinse out the
Mm-hmm.
thoughts, rinse out our mind, and rinse our body, we can live
Mm-hmm.
infinitely with it. So we have to practice wearing good bras. We have to practice
Right.
eating healthily, and we got to
Right.
practice in noticing our body, listening to our bodies as women.
Yes.
And when we go to doctor, we must question doctors about our lymph nodes. If the cancer from the womb get
Right.
into the lymph nodes, we are fucked.
Oh yeah.
If it gets into the lymph nodes, and we got to understand as well that cancer got 5 stages.
Okay.
Stage 1 is when you just find it out. You are
Mm-hmm.
safe if it gets to stage 1.
Right.
Stage 2 is when it is challenging you. Now, when it
Okay.
gets to stage 3,
Right.
when it gets to stage 3, we are in danger. And 4 is when it is killing us, and 5 is when we're dead. No coming back after stage 5.
Hmm.
Mm.
Yeah, that's a very important point. So you got to actually, as you said, listen to your body. Um, you have to listen to your body, and also
Listen,
eh,
communicate with it.
yeah, any early signs that you see of something indifferent, you must actually check it out.
Yes,
Don't
because
take
my
it for
sister
granted.
had it.
Mm-hmm.
My sister had it, and sadly, she knew she had it and she didn't tell us.
Right.
And she suffered. She really suffered until she passed away.
So what happened? It was too far gone? It moved from the breast to
Yeah,
other areas, and then
it took up.
as a
It
result,
took up. Once it got into the lymph nodes,
right.
it got the yes. Her breast became like when you put overripe jackfruit.
Mm-hmm.
That was what I experienced with her, and
Eat
also
her out.
yeah, yeah.
Yeah.
My auntie, her
You
breast
know.
was taken off. Her breast was taken
Right.
off, and she's still, because it was in the lymph nodes.
Oh, too far gone.
I just went through a purification where the worms came out of my body, and
Okay.
also the the bag that was carrying the germs, it came out of my body
Mm-hmm.
by itself, a black
Oh,
bag
yeah.
with blood. Yeah.
Oh, so there's
Mm,
actually a bag that carries
mm,
these things.
yeah.
Oh, yes.
It's a little
So how
socket.
did it come out of your body? How did it come out of
Because
your
I
body? You
didn't.
like pass it? You pass it like
Yes.
stool? Oh, okay.
Yes. I went through a purification program
Mm-hmm.
where I had to do certain exercises
Mm-hmm.
within the organization, and I had to take like 3 to 4 grams of lecithin and a lot of compressed oils and put together to remove the bad oils from my body and to replace it with great good oils. And then I had to take
Oh,
bioplasma. I had to take vitamin B. We all need vitamin B. We must take vitamin B like food. We must
okay.
take the proper vitamin B, and we must go on the vegetarian website and buy it from them, because Holland and Barrett and all of them, they are mixing it.
Yeah, yeah. Have to move back a bit. Move back a bit from the camera. Yeah, because if you move back a little bit, yeah,
Yeah.
there you go.
So
You're fine. Yeah,
with good thinking and clean living, we can live with cancer.
right. So what you were saying is that you were actually developing cancer then,
Yeah, absolutely, yes.
because if once you say you got rid of that bag that carries the cancer, therefore there it was a sign that it is there, just lurking.
Yeah, my doctor said to me, Donna, I'm sending you off now for a transvaginal inspection.
Oh, okay. So basically you
It is called a transvaginal inspection.
okay.
2 days.
Wow. All right, well, let me just read what Shani have to say. Yeah, man, good evening, Shani. Sorry about that. I love you, Shani. I was just waiting for Donna to finish talk before I acknowledge her. All right. So she said, yes, dimples in the breast is also is a sign of breast cancer. She's saying that firmness but
Agreed.
no pain. Sometimes anything irregular, get it checked out, which is what we are just talking about. Anything, any signs that you see with the breast that is totally outside of the norm, you get to check out. What no, sir, she says, what would cause infection? Yeah. She said, okay, let me read the other thing that she has here before we get into that. She says, bless up, Delvin. All my condolences to this lady for the loss of her sister. Being alkaline is the best way, and coconut oil and pure sulfur. Okay, yeah.
Yes.
All right. So there was a condolences to the lady that passed away as well. Yeah, I don't know who she is, but I'm healing up her family and saying up my condolences as well. So yeah, you have to have the body alkaline. So in your case,
Princess Black says she's afraid.
she what? Oh,
Princess
yeah,
Black said, I don't
Bellamy.
love this topic.
Beverly Bellamy is the person that yeah. And Shani, you're reading well. Shani, and after Shani, yeah. It's Beverly Bellamy that said she have somebody that passed away from it. Yeah. Sorry about that, Beverly.
Condolences.
Yeah.
Mm-mm.
Yeah. Yeah. So in your case now, what were your signs why your doctor had you checked out?
I wasn't feeling well within myself,
Mm-hmm.
and I had a lot of issues. I had a lot of issues that I wasn't comfortable. I had feelings in my abdomen.
Right.
and a lot of feeling around my, because I'm a spiritual practitioner, I call it the chakras of the body,
Okay.
or some people call it the endocrine system of the body.
Okay.
Yeah.
Yes.
So I started to see and feel things. I went through menopause. I went through early menopause without
Okay.
even knowing anything. And I didn't have to
Mm-hmm.
take HRT or anything like that.
Right. Okay. All right,
Yeah.
Shani. Yeah. Uh-huh.
So
So you
once I
started to
saw a
feel
certain movement,
right. You know something was wrong, out of line.
yeah, yeah. And then you didn't want to,
Okay.
and I didn't want to suppress family members, so I kept it to myself. And I
Okay.
saw the right people at the right time.
Okay. All right. So your doctor sent you to get a purification.
No, he sent me for a transvaginal inspection.
Okay. And what is that
Mm.
process entail?
That process, it sends a video recorder up inside of your body,
Okay.
and
To
it can show
inspect
you where
what's
the
going
black
on inside.
spots are.
Mm-hmm.
Yeah, and it can show you where the black spots are.
Mm-hmm.
If there's any bruised blood being collected in any sac anywhere
Right.
around. And when she
Mm-hmm.
saw mine, she couldn't believe it.
Okay.
And then
All
she
right.
showed me
So the
the little
process.
string.
Mm-hmm.
She showed me
Okay.
that it
She
was
showed you
hanging
in the
onto.
camera.
Yes.
Yes, from the camera. All right. And right away she move it a bit. Remove it right away, right?
No, she didn't move it straight away. As I
No.
said, it took
Okay.
me 2 days and
For
then
the
I
process to.
passed it out.
Oh, I see what you're saying. So what
Yeah.
exactly was the process that you had to go through before you actually were able to pass it? They put you on some laxative or they give you something to target it?
They put me I only take herbal medicines.
Oh, I see what you're saying. So you
No form
actually,
of drugs.
so
No
you
form
actually,
of drugs is in my body.
right. So you had to no go through a herbal practitioner. All right. So we want people to understand what's going on here. So you went to a herbal practitioner, which now gonna deal with it from a herbal perspective to pass that,
Yeah.
correct?
Yeah.
Okay. And
But I still stuck with my doctors. I didn't ignore my doctors.
right, right. So your doctor was aware of what you were doing
Yes.
when you went to them. All right. So
Yes.
once they give you whatever you had to take and you passed it out, did you actually went back to the doctor to get a rescanning to see whether or not
Of
it is
course.
done?
Oh
Okay, you did.
yeah.
Okay, okay.
Mm.
Yeah. So it does work.
Yes, and he's got my success story.
Oh, okay. The doctor has your success story to share. Okay, so now the method to which you use, he can now refer people to that as a method that works.
Oh yes, he has been. Yes, they have taken on. I took back information to them. He takes it, and for those who are prepared and ready, and those who've got open minds.
Right. Yeah. That's an alternative things that can work instead of surgery. You gone? Yeah, man, I could big up some people while she come back. Yeah, I can big up some people. Big up yourself, Sharon. Yeah, man. Thanks for joining Unscripted Anything Goes. Janet Smith. Thanks for joining Unscripted Anything Goes. Desreen. Thanks for joining Unscripted Anything Goes. I hope you're feeling better, girl. Yeah, cancel her and bring her back on. Because this is some very good information that we're getting here. Donna. Yeah, man. Very good information. I like information like this, you know, because it shows that people, if you see something, you do something about it. something is outside of the norm of your body, you know your body. You know your bodies. So if something is outside of the norm of your body, you don't wait. You go to the doctor right away and you get it taken care of. You get it taken care of. And the good thing about Donna is that she saw something outside of the norm. She went to her doctor. Her doctor got her scan, and it was identified as cancerous. And then she took an alternative means, the herbal way, and got it dealt with. And her doctor confirmed that she's now clean and healthy. And as she said, her sister had it and died from it as a result of it. And one of them even had their breast taken off. So people, breast cancer is a serious thing. It's a very serious thing. So we must actually, don't wait if you see something different. Big up yourself, O'Neill Luton. So this information that I'm going to pass is from the medicaldaily.com, and it's a UK site as well. It says that breast cancer is the most common cancer in women, regardless of ethnicity or race. Yeah, regardless of what ethnicity that you are on, it is the most common form of cancer in women. Yeah, man, it's the most common form of cancer that you'll find in women. Yeah, it's not something to be taken lightly. Yeah, it can be classified into two types depending on where the disease starts in the breast and how it grows. Yeah, straight up. So, breast cancer is most common cause of death. Yeah, listen carefully, Breast cancer is the most common cause of death from cancer amongst Hispanic women. So if you're Hispanic in woman and you're here, I'm gonna bring you on in a minute, Dana, once I finish this part here. If you're an Hispanic woman, this is the most common form of death in Hispanic women in the United States, according to the Center of Disease Control and Prevention. The latest figure from 2013 shows that 230,815 women and 2,109 men in the country were diagnosed with breast cancer. Yeah, for real. It says these, of these people, 40,860 were women and 446 men died from breast cancer disease. Yeah, you hear that? Of the number that I referred to, the 238 to 230 women. Yeah, 231,000 women. Of the 231,000 women, of those, 41,000 died from breast cancer. And of the 219 men who diagnosed with the breast cancer, 2,109 men, of those, 464 of the men them died. So men can actually get breast cancer too. It's not just limited to just women. Yeah, man, straight up. Yes, one of my girlfriend had surgery today for breast cancer. You see that? You see that? Yeah, you see that? This is not something to take lightly, people. Not something to take lightly. You got to check out on screen. Yeah, if you see something outside of the norm and you have your breast examinations that you're supposed to do, do your breast. Yeah, you have to do your breast examinations to make sure that nothing outside of the norm exists around the nipple and and the breast itself, inside and outside of the breast. You have to feel for lumps and all of these things, so that if you feel something, you go to the doctor and have them check it out straight up, because the proof is in the pudding. People are being diagnosed with breast cancer, and people are not only being diagnosed, people are dying from breast cancer. So it's very important to get yourself checked. I'm going to give you those numbers again, and we're going to look at those numbers. Yeah, we're going to look at it in detail. So 231,000, 2013 alone. 231,000 women diagnosed with breast cancer in 2013. 2,100 men diagnosed with breast cancer. Of the 231,000 women, 41,000 women die of breast cancer. And of the 2,100 men, 464 died of breast cancer. Those are serious numbers. Those are some serious numbers. Because a lot of people feel as if I am feeling okay. I can walk good. I don't feel any pain. Everything seems fine. And they see something outside of the ordinary, or they feel a little twitch there, and they don't get a check until it's far too gone. The next thing, them dead. Don't be one of those people. Yeah, make sure that you check yourself. Yeah, it's your own self. Examine yourself, touch yourself, feel yourself, look at yourself. Yeah, you know what yourself's supposed to look like. Anything outside of the norm, go and see the doctor. Go and see the doctor. Yeah, yeah, man, straight up. Yeah, yeah, man. Did the numbers show how many are blacks? No, I didn't look at it from that point of view. It's a good thing. I should have checked on it from that point of view. I look at it from a broad base. But it says majority of the people in America, yeah, that die from breast cancer are actually Hispanic women. Yeah, Hispanic women. Yeah, I don't think we would be too far behind, to be honest. Yeah, straight up. Cancer is not about black or any color. The clever thing is, it is your responsibility. Yeah, it is responsible. Things is to be responsible. Yeah, man. And it did say that at the top of before you came in, Desiree, I think I said it. It says it is common in women regardless of ethnicity or race. It doesn't matter what kind of ethnicity or race that you are. Yeah, it is common. Lord, my doctor probably tired of seeing me. Yes, Jacinta, yes. And that's the good thing about Jacinta. Jacinta is at the doctor every time. Yeah, yeah, and so am I. Yeah, yeah, straight up. I don't go as often as her. But that is what they're there for. Yeah, that is what the doctors are there for. They are the expert that you should go to. They're like the human mechanic. If you want a car fix, you go to an auto mechanic. Yeah, you go to an auto mechanic. Doctors are human mechanics. Anything outside of the norm, you must go to them. Anything that just arises out of the dog, you go to them. And on an annual basis, you must go to them for a tune-up. Yeah, you must actually go to the doctor for a tune-up just the same way as you would go to get your car tuned up. That means they should check everything. You check all of your blood. Yeah, all of your blood. You check your blood pressure. Them looking at your throat. Them check your heartbeat. Everything. They examine your every aspect of your body. You get checked for cancers, STIs, everything. You go to the doctor, and that's their job to do that. Do not be afraid of them. They're the human mechanic. You go there and you get yourself checked out. It is just the right thing to do, people. Yeah, I can't beseech you more. What could happen? What is the worst thing that could happen? You have something that needs to be treated or operated on. Yeah. So if that's the case, it's early detection. The earlier that you detect it, it's the earlier that you can be cured or treated. Yeah, and the longer that you live. You don't go. You don't find out. Shorten your life. Yeah. For what reason and what purpose? Yeah. Straight up. You got to do it. You got to do it. Yeah. It says here, let's see what Donna has to say. My doctor is always happy to see me. We have developed a bond, which is respectable, which is right. Yes, so your doctor know you. My doctor know me. Jacinta doctor know her. Yeah, them know we. Cause we dead here. We're good for business. We're good for business for them. But as far as we are concerned, yeah, we are supposed to go to them for them to keep us healthy because they are the expert at that, or to refer us to somebody that can help if something is wrong. Yeah, straight up. Yeah, my mother died from cancer also. My grandmother, so I get my mammogram regular. Good girl, Desiree. Yeah, I also get checked for ovarian cancer also. Very good girl. I'm going to tell you a little story, okay? And I think I told Jacinta this story as well. And I've told it to other people. There's a girl in our community where we're from, where Sharon and I are from. Yeah? And yeah, her mom, I think, died from cervical cancer. Right? Her mom died from cervical cancer. And her daughter, the ministry keep writing her to tell her, you know what, come in and get yourself checked. Come in and get yourself checked. And she wouldn't go, you know? Because this could pass through the genes and she could get it. So they keep telling her to come in and get herself checked. And, you know, this is a neighbor of mine and she wouldn't go. And actually she got sick. And instead of going to the doctor now to get herself checked, yeah, she now seeks out Wobia people. Wobia people. Because it's Wobia people who she think made her mom die. And as a result, they're trying to make her die as well. So the belief that is in her head warped her mentality that, you know what, the doctor is the place to go. So you got to actually act upon your health and not allow these people to distort your mind to think that, yeah, as somebody is trying to do something to you, yeah, it could be something in you that needs to be corrected or fixed. In her case, had she gone when they wrote her to tell her to come and check her out, she probably would still be here today. And she died leaving young kids. What a thing. She left young kids. And if you leave young kids, and you could have actually extend your life, it's as if you committed suicide. It is as if you committed suicide and you leave those young ones without you completing the responsibility of parenting them. Yeah, no, somebody else now have to take up that gap that you leave. Yeah, what a disgrace. What a disgrace. Yeah, shame on anybody that if you know that you should go to the doctor and don't go and check yourself out, shame on you. I am beseeching you tonight, people. Yeah, go to the doctor and get a regular annual checkup. And not only that, go when you notice something outside of the norm happening to your body that is not normal to your body. Straight up, I'm beseeching you to do that. Yes, Donna, what you saying? My God, her mind got twisted. I'm gonna have to fix her mind. She dead. She dead. There's nothing to fix. She dead. Yeah, she died. She died. She died. Yeah, she died. And she's younger than me. She is a dead woman. Yeah. Yeah, because she did not, even when sickness come upon her, she did not go and get it checked. Yeah. We got to be careful, people. We got to be careful. Make sure you go to the human mechanic, the doctor. That is what they're there for. Yeah, man. Go to the human mechanic, the doctor. Yeah. True that your body speaks to you all the time. Yeah, it does speak to you. And it shows you sign that something is wrong. And if something is wrong, you go and check it out. Yeah. So what he's saying is that Yeah, big up yourself, Selassie Punch. Big up yourself, my brother. Thanks for joining. Yeah. So what it's saying here is that this type of cancer can be evasive. Breast cancer can be considered evasive, all right, invasive or non-invasive. So invasive breast cancer, it's saying, all right, it is most common type of cancer among American women. Invasive breast cancer. Big up yourself, my brother Gilman Sterling. Yeah, it is also known as infiltrating breast cancer. Invasive breast cancer can spread to the normal tissue in or around the breast. Yeah, it can also spread to other body parts through the blood lymph nodes system, just as Donna says. Yeah, so that can actually move from parts of the body to the next part of the body. So it don't just stays in one place. It can actually move to different area of the body, and it also get into the lymph nodes. And if it gets into the lymph nodes, as Donna said, basically you can kick the bucket. You're gone. You're gone. Yeah. So malign cells, and malign cells is a term for disease which is abnormal cell divided without control or can invade nearby tissue. So the cells itself start to divide without control, and it now spread to nearby tissues. So malign cells, malign cells can also spread to other parts of the bodies through the blood and the lymph nodes, just like Donna says. It can be present in the form of milk duct or lube tubes, whatever that is. Yeah, that is non-milk glands. Yeah, so what happens is that the cancer cells now doubles when it's maligned, and it splits itself and now starts spreading to different area of the body. So you got to be careful. Be careful with this cancer thing. It can actually become even worse if not looked about right away. Yeah, man. The other day I went to the hospital. Yeah, when I had to do my surgery there, and I went to the what do you call it, the radiologist department. And people, listen to Delvin, listen to me carefully. If you never been to the radiologist department, yeah, if you want to know how serious cancer is, you just go to the hospital and you see what happens. Yeah, the good, the bad, and the ugly is there. People just going in and out of labs to get radiation treatment, chemotherapy. Yeah, you see ambulance pulling in, you see people walking in, you see people coming in on stretchers, you see old people, young people, little picnic, just going in to get radiation because they're diagnosed with cancer. Yeah, they're diagnosed with cancer. Yeah, so they're there for radiation treatment to actually destroy the cancer cell or to shrink it. Yeah, so you got to know, people. You got to know that this thing called cancer is a dangerous thing, and you must take it upon yourself that if you notice something different with your bodies, go and get it checked out. It's not. This is why I bring these things up, because I see with my own eyes. Yeah, I see with my own eyes. I had a girlfriend that died of ovarian cancer. She died because she didn't have a general checkup over 10 years. Oh God. She said she didn't go to the doctor because she was only with her husband. That cancer have nothing to do with that. And she was married. She got sick and went to the doctor. She was already stage 3 of the 5. And in less than 3 months, she died. So it goes to say, even if you have only one partner, you should still need go to the get medical examination annually, both general and medical for ladies. Yeah, yeah, you're right about that. You're right about that. Desiree. Um, listen, you don't just go to the doctor for STDs. You don't just go to the doctor for STDs or STIs. You don't go there just for that. You understand what I mean? So if you're saying that, I am only having unprotected sex with my spouse, and we're both monogamous, we're committed to each other only, and we don't cheat and all of these things, so that means I am healthy. You might be healthy of STIs, but you could be dying from other things. Yeah. So the physical that you go there to do, the full body physical, it don't just based upon STIs. The blood work that you do now, it checks for cancers as well. The blood note checks for cholesterol levels as well. Yeah, it checks for other disease or cancers that's in the body. Yeah, and earlier detection is earlier treatment possibilities. So in her case, because she never get an annual checkup every year, yeah, because she think that she's clean and healthy because she's only have sex with one person, yeah, she think it's just that sex you can die from, but she had the cancer sitting there that was killing her, and not know about it until it was too late. Until it was too late. Do not, I'm beseeching you ladies and everyone in the room, do not become a victim. Yeah. Oh, the gynecologist. Okay, alright, yeah man, the gynecologist. Yeah, man. Yeah man, go to the gynecologist. Yeah, straight up. Yeah man, do not people, do not become a person that don't go to the doctor and get a full physical done. Yeah, the gynecologist. Yeah, go to the gynecologist. Yeah man, routine blood check for me discover diabetes. Yeah, so my wife, she has this been recently diagnosed with diabetes. Yeah, and yeah, straight up. So she's now taking pills, and to get her eating habits in check in order to actually make sure she's healthy. And hers is caught early stage of it. You understand? So the good thing about it is that she constantly get her annual checkups, and she goes when she sees anything. So, and when something is outside of the ordinary, our doctor, him just check everything. Him check everything. Yeah, man. Him want you to know, and him want to know as well, so he can give you the best treatment possible for you. So she was diagnosed with the diabetes, and in no time she's back. Yeah, we went back when, couple of weeks ago or last week, and based upon what he tell her to do and what she change her eating habits, she's now have a clean bill of health. She's fully under control with her diabetes. So that is the same thing that you must do, people. You go to the doctor, and anything that comes up, it comes up early, you get the best treatment as possible. Yeah man, regular checkup, you must get it all the time. We get it every year. I go there and get my checkup. I look forward to getting my checkup. Yeah, I look forward to going there. Yeah, I go there every November. Yeah, so I start the year fresh. Yeah, I know I'm in a clean bill of health. Yeah, straight up. Yeah, man. And if I go there and say, oh, I haven't seen you for a little bit. Yeah, I go there and the doctor said, let's say I've been there like November, and then I go back like in say August, and they say, oh, you haven't been here in a while, man. What's going on? Full checkup again for me. Yeah, that they say, oh, full checkup for you again. Yeah, man, we're ordering everything again for you. Yeah, because the doctor now has my health interests at heart and want to make sure that I'm healthy. You know what I mean? That's the kind of rapport you must have with the doctor. Yeah, go to the doctor and get yourself checked up. But back to what we're saying here. Yeah, straight up. So, the non-invasive cancer now. Yeah, the non-invasive cancer, breast cancer. These type of cancers are known as situ breast cancer. This means that the cancer cells are limited to the single place. Yeah, so just like the invasive cancer, where it's malign, where the cells split and now spread to different areas of the body. The non-invasive cancer is just limited to that localized area only. Yeah, so this means that the cancer cell limit to the single place and do not spread to tissues around the milk duct areas. These two types of cancers, blah 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 blah. Yeah. So in other words, there's a localized cancer, and then there's a malign one that spread to other areas. So you now have to know, go and get checked so that the doctor can deal with your specific case individually. Let's see what Desireen has to say. Yeah. Jacinta, diabetes is running my family. So for me, more than 15 years, I haven't used sugar. I use Splenda and honey. Oh, yes, girl. Yeah, straight up. Yeah, man. If you do like Delvin, just don't drink not wife sugar night. Don't drink not the wife sugar night. Yeah, I don't drink no juice. Yeah, I don't drink juice. I don't put sugar in my tea. I just drink the tea black. Not even milk in it. Straight up black. I don't put sugar in coffee or milk. No, straight up black. Yeah, man. Yeah, man. So all of a sudden, the things that you thought wouldn't taste good, now you get the full and proper taste of it without the added attachment to it. You'll be surprised of how good coffee tastes without sugar, and tea, how good it tastes without sugar. Yeah, or milk. You get the real sense, the real taste of the coffee and the tea. Yeah, man, I like it better. Yeah. One time I went to McDonald's and buy a coffee. Yeah, and it's like they mix up my order. You see, as soon as they come, so as soon as I went like this, I taste the sugar and the milk. Boom! It's like I tossed it away so fast because my taste buds now, yeah, that is foreign to it. It's foreign to it. And it's years now I've been doing that and I enjoy it. Yeah, man, let's see what you have to say now. Malign melanoma is dangerous too. Okay. Yeah. That's on the skin, right? Yeah, straight up. Yeah. So try to discover the type of diabetes and do a lot of exercise. Yeah, she has type 2 diabetes. Type 2 she has. She don't have type 1. My daughter has type 1. Yeah, my daughter has type 1 and she actually went blind because of that. Yeah, she actually went blind. But the good thing about that is that the lens can be replaced because of the glaucoma. Yeah, so they replace her lens and she can see perfectly. So now she has to be on a strict regimen where eating is concerned. Yeah, man, straight up. Now I stop using sweet sweeteners altogether. Yeah, man, Jacinta is good right now. Yeah, man, big up yourself, Jacqueline Coward. Thanks for joining. Unscripted, anything goes. We're talking about cancer tonight, breast cancer particularly. Yeah, man, straight up. Yeah. So for the males can also have breast cancer too, you know. Yeah, man. Yeah, this is for you too. Men can get this breast cancer. Yeah, breast cancer is actually it's rare in men. However, when it occurs, it often it often what do you call it now? Ductal carcinoma. Yeah. So they do get breast cancer, the male. Yeah. So a rare form of breast cancer. It's called Paget's disease of the nipple. And I think Donna was talking about that. Occurs when cancer cell gathers in and it gathered around the nipples, in and around the nipples. So you have to examine your nipples, ladies, to see that there's no abnormalities around it or any little puffs up areas around your nipples that normally is not there, because that is a sign of breast cancer. Oh, you're going to sleep. All right. Yeah, I love you, Donna. Thanks for joining, and I enjoyed the story tonight. Yeah, man. See you tomorrow. Yeah. So recurrent. It says recurrent breast cancer. It says this type of breast cancer has returned following treatment or spread to other parts of the body. So you got to be sure that you keep getting yourself checked, because the cancer cells can now return and spread to other areas of your bodies. Yeah, man. Big up yourself. Big up yourself, Teresa. Thanks for joining. Good night. Yeah, man. Good night, Dana. Yeah. Straight up. yeah. Straight up. So I also went on the netdoctor.com, .uk, the netdoctor.uk, and I got some more information here on breast cancer. It says in the UK, each year over 50,000 women in the UK. In the UK, over 50,000 women are diagnosed with breast cancer every year. What a thing. In the UK, over 50,000 women are diagnosed with breast cancer. Yeah, affecting around 1 in 8 women in their lifetime. So, how many people in the room now? How many women in the room? 1 in 8 women, in their lifetime will get cancer. And while it remains the most common cancer in the UK, the good news is that more people survive breast cancer than ever before. So that's good news. So you have to get yourself checked out. So, even if you're diagnosed with it, your chances of survival is pretty high. Early detection, as we spoke about, improved treatment, screening programs, and public awareness is all a factor that means survival rate diagnosis are actually improving all the time. For Breast Cancer Awareness Month, we speak to they said that they spoke to this guy named Addy Mitchell. He's a specialist of breast cancer care about the disease, and this is what he has to say about breast cancer. So this is per Mr. Addy Mitchell. This is what he has to say about breast cancer. He's a specialist in the area. He says, 1, breast cancer is not one single disease. It's not one single disease. There are actually several types of breast cancers, which we did gone into earlier. All right, but I'm going to go through what Mr. Addy has to say. He's saying that the disease isn't the same for every woman and can be diagnosed at different stage and grows at different rate. Some cancer can be more aggressive than some, according to Mr. Addy. Breast cancer treatment is individually tailored. So they will tailor your treatment according to the stage to which your cancer has developed. For what works best for one person may not actually benefit another person. So based upon the cancer aggressiveness in you or the stage of your cancer, they will tailor a treatment specifically to you. The second thing he has to say is that very few cases of breast cancer is hereditary. Very few cases of breast cancers are hereditary. One of the biggest misconceptions of breast cancer is that you only get it if someone in your family has been diagnosed with the disease. Right. So that is one of the misconceptions. In fact, very few cases are hereditary. Very few cases pass through the genes. Yeah, according to Mr. Addy. Very few cases of breast cancer pass through the genes. Yeah. A lot of people think that breast cancer is genetics. But it is very common myth. Only 5% of breast cancers are caused by inheriting the genes. Only 5% of people inherit the breast cancer genes. It is very common cancer, she says. So it's a very common cancer. It can just develop in your body. If you're worried about genetic links to breast cancer, and then you're of a higher increased risk. So speak to your general practitioner. So you check out yourself to make if somebody in your family had it before, or your mother or somebody like that, your father, yeah, and you feel as if something is outside of the ordinary. With that said, you just go and get it checked. Yeah, as a result, because it's only 5%, but the 5% which your personal risk now make you a higher risk. So you go and get yourself checked out. Knowing how your breasts look and feel is very important, he's saying. You have to know your breasts. Yeah. You have to feel up your breasts. You have to feel up your breasts. You have to know your breasts. Knowing how your breasts look and feel is very important. Yeah, you have to feel up yourself. Feel up your breasts. People, woman, feel up your breasts. Yeah, feel up your breasts. All women should all women should be breast aware. You have to be aware of your breast, says Mr. Addy. It's about noticing what's different or what's abnormal for you as an individual. So, because if you know your breast, you know what is outside of the norm of your breast. It's abnormal. So if you constantly feel up your breast, when something is different about your breast, you will know about it. Check yourself when you feel most comfortable, whether that is in the shower or in the bath or in your bed. So constantly check yourself to make sure that your breast is how you know it to be. And if you touch your breast and it feels different than what you're used to, go and see your general practitioner, your doctor. Yeah. Straight up. She says the signs and symptoms to look for are these. So when you check your breasts, here are the signs and the symptoms that you should look for according to Dr. Addy. A change in size or shape of one or both of your breasts. Yeah, so you have to know, check the size of your breasts and see if it get bigger, smaller, or in one or both of the breasts. You have to check them to make sure. If I were you, I'd keep one of those tape measures that they use, to the dressmaker them use. Keep one at your house and measure your breasts. Yeah, keep one at your house and measure your breasts. Every damn day, you measure your breasts. You measure the width of it, the length from the nipples back down to your chest, yeah, around and around the circumference, and you make sure that it's the same size. Or even while you feel it up, you feel like it's feeling smaller, you check where you feel like there's probably an indentation or a lump. Yeah, you go and check it out. Yeah, according to Dr. Hattie, it says a lump or area of thickness tissue. Check for a lump or area of thickened tissues in either of your breasts. So if you find that the tissues now start to get thickened or hard, yeah, then something is wrong. Something is wrong. That is outside of the norm. You check your breasts them for a lump. You feel up yourself for breast. You feel your breasts. See? Check it. Check for lumps in them. Don't be afraid to feel up yourself. Feel up yourself, girls. Feel up your breast them. Feel up your breast them. Yeah. And if you have a breast man, a man who love breasts, yeah man. Yeah, man, every time him finish feeling up your breast, then you ask him, you feel anything different? Yeah. Yeah, every time him feel up your breast, you ask him, do you feel anything different? Yeah, straight up. Yeah, and where did you feel it? Yeah, and you check it out. Yeah, straight up. Feel up your breasts. Touch up your breasts, people. Touch up your breasts. Yeah. He also says, according to Mrs. It's a female, Dr. Hattie, she says, a pain in the armpit or breasts that doesn't go away. You have a pain in your armpit or in your breast and it doesn't go away. Yeah. Pain is rarely due to breast cancer, but if it won't go away and don't feel right, get the pain checked out. So you have a pain in your armpit or in your breast area here. Yeah, it's not necessarily a sign that you could have cancer, but you get it checked out just to make sure that it is not a cause of something else that could be cancerous. Straight up, check yourself. Check yourself. Don't just ignore the pain. It could be a sign that you could have breast cancer, so you make sure you check it out. Yeah. According to Dr. Addy again, redness or rashes. Yeah, particularly around the nipple area. Yeah, redness or rashes. Yeah, it could be a sign that you've got breast cancer or developing breast cancer. Yeah, check it out. Check out the nipples for redness and rashes. Yeah, a swelling in your armpit. Listen to that again. A swelling in your armpit or around your collarbone. Yeah, which is abnormal. So swelling around your armpit or your collarbones. Yeah, straight up. Could be signs you've got breast cancer according to Dr. Addy. Yeah, a discharge from either armpit. A discharge from either armpit. And I have seen discharge from a woman's armpit before, but I did not know. I didn't know. Yeah, that's a sign of breast cancer. I did see it. She showed me too. She comes and squeeze the armpit and the discharge came out of it. And I doubt she knows that that is a sign of actually, what do you call it now? Breast cancer. So according to Dr. Hattie here, a discharge from either armpit. Yeah, that could be a sign of breast cancer. Yeah. So knowing what your breasts look like and feel like can help you find changes in the future. It is also important to check all around your armpit, collarbone, and sides of your breasts, explained Dr. Addy. If you notice any changes, always get them checked out by the doctor. Yeah. Yeah, so you have to, if anything around the breasts, you're going to have to check it out, including the breasts and the nipples that is outside of the norm or abnormal or painful. Dr. Addy says you should get it checked out. Straight out. Straight up. Yeah. The fourth thing, a lump doesn't always mean that there is a cancer. Yeah, according to Dr. Hattie, a lump doesn't always mean that there's also a cancer, but you have to get it checked out regardless. A lump in the breast is the most recognizable knowledge signs of breast cancer. That's the most recognizable knowledge sign. But according to Dr. Addy, 9 out of 10 times when you get it checked out, it is something benign or non-cancerous, right? So it's not necessarily something that is going to turn into a cancer. It's just a lump that just developed, but it won't become cancerous. Yeah, sometimes, but sometimes it turn out to be cancer. So if it's outside of the norm and you feel it, you get it checked out. Don't just sit there, yeah, and accept what it is. Get it checked out. Get it checked out. Yeah, man, straight up. For the most part, according to Dr. Addy, yep, it is going to be cancer. Yeah, for the most part, it is going to be cancer. Yeah. Many symptoms such as a lump may be due to, normal breast changing or benign breast conditions. But obviously, if you do notice anything, speak to your doctor. Yeah. So for the most part, it's not going to be cancer. But if you do notice something, don't just sit on it. Go and see the doctor. The fifth thing, according to Dr. Addy, that you should check for, it's saying, Dr. Addy is saying, breast cancer screening will save life. So you must get a breast cancer screening. Dr. Addy says, research reveals that breast cancer screening program may prevent around 1,300 women in the UK dying from breast cancer every year. So because these women go to get their screening done, as a result of getting their screening done early, their situation was actually detected early by the screening. And as a result of it, every single year, because of screening, over 1,300 women in the UK survive breast cancer every year. So it's important to get it screened because they were detected through screening, and as a result of it, their lives were saved as a result. Because the cancer is more common in women over the age of 50, women aged 50 to 70 are invited to routine screening every 3 years. So if you're over the age of 50 to 70, screening should be done every 3 years. Straight up, you're invited to make sure that you get your screening done every 3 years. Straight up. Unfortunately, most women over the age 70 are not automatically invited to screening, but we would still encourage these women to attend. They are actually in a bigger age category of having breast cancer. Straight up. All right. So lifestyle and factor matters. Your lifestyle and your factor matters, according to Dr. Addy. According to Dr. Addy, leading a healthy lifestyle can indeed help lower your risk of breast cancer. If you are living a healthy lifestyle, it can help reduce your risk of breast cancer. A new study found that convincing evidence that eating healthy or eating a healthy diet, you exercising, limit alcohol intake, and maintaining healthy weight would reduce your risk of breast cancer. Right? So you're eating healthy. You're eating an healthy diet. You're exercising. You're limiting your alcohol intake and maintaining an healthy weight. That would reduce your risk of breast cancer. It is difficult as we don't know exactly what caused breast cancer, according to Dr. Addy, but there's good sufficient evidence that keeping your weight down, increase your exercise, and maintaining healthy weight does lower your risk to breast cancer. These also some of the evidence that can these also are some of the evidence that even a small amount of alcohol can affect your risk. Even a small amount of alcohol can affect your risk. So watch your alcohol intake. Although we don't know how much yet. Even though we don't know how much alcohol can affect your risk to breast cancer. Just limit your intake. Don't get addicted to that shit. Alcohol. However, says Dr. Addy, the most significant risk factors for developing the disease remains being a woman and getting older. So the older you get as a woman, it's a more your chances of getting breast cancer is. So while you get older, you more examination and screening you need, and the more you need to feel up yourself and touch your breasts to make sure that nothing is outside of the ordinary, and get it checked out. Yeah, man, get your Anika while physical done, people. Yeah. Men can get breast cancer too, according to Dr. Addy. Alright, so this is the last area that we're going to touch before we wrap up the show. According to Dr. Addy, men can get breast cancer too. Yep. Many people don't realize it, but because breast cancer can affect men also as well. He says both men and women have breast tissues. Yeah, man. Breast tissues. We all have breast tissues, although men have much smaller amount. Yeah, currently breast cancer affect approximately 400 men in the UK every year. So it is very rare, yeah, in comparison to women. But they do get it. Men do get breast cancer, and men actually do die from breast cancer in the UK. And based on the statistics that I read from in America, in 2013, 2,100 men got breast cancer. And of those 2,100 men that got it in America, 464 of them died from breast cancer. That is a very high risk ratio as opposed to the woman. And the woman in 2013 in America, how much was it again? 248 or 41. Yeah, 231,000 women got breast cancer in the United States in 2013. And of those, 41,000 of them died. 41,000 after 200. Yeah, died. So you see how important it is to get yourself, examine yourself first of all, and get your annual physical done and a screening to make sure that you don't get breast cancer or any form of cancer. Go to your doctor. Yeah, man, straight up. Yeah, man, so that is the lecture tonight on breast cancer. Tomorrow we're going to talk about cervical cancer, and the day after we're going to talk about ovarian cancer. Any questions before we wrap up the show? Yeah, man, any questions? Yeah, normally people don't have questions. So tomorrow we're going to talk about cervical cancer. So if you know of any ladies, invite them to come and listen to the show tomorrow, because we're going to talk about cervical cancer tomorrow. Yeah, man, straight up. So people, remember to embrace conservative values. We don't have badges nor guns, so we must support the police. So we're here tomorrow. So until tomorrow, Delvin is saying, I love you. I love you. Bye-bye.